We took that expression, if we could just get everyone to the table, and we took it seriously.
We're at an event that the City of Bloomington Public Health, in collaboration with the Office of Racial Equity, Inclusion and Belonging, hosted with the help of Marnita's Table, who is a community-based organization that facilitates community conversation, and today's topic was around mental health.
What we're trying to do tonight is identify what might be some spaces where we can pop up to have engaged conversations about mental health mattering.
MDH has funded the Public Health Division with a grant to do innovative work that is impactful in the community. The intention of this event was to start the conversation and to really gauge who's in the room, who's not in the room.
Who should be here? More elders.
What the issues are that rise to the surface for these communities, and to then culminate into pop-up events.
Do you feel comfortable seeking mental health resources or asking for mental health support?
We took the technology that retailers use to make you happy to part with your money, and we repurposed it to make you happy to part with your preconceived notion of the other. So instead of telling people that they're racist or that they don't like people or any of those things, we just say your community is constantly changing and you need to learn a practice to be authentically welcoming. You notice we're having language support.
Yo estoy muy emocionado de estar aquí para.
We slowed down to make sure that we were providing access to somebody who was in a wheelchair. When we started asking, like, where should we go or how do you want to identify? Did you notice people were saying, well, I'm a little of both. Somebody said, you don't have a sign for me. We didn't say, oh, we don't have a sign for you. We said, let's make a sign. And it shows you practice-based evidence. Those little steps that we took in the room, it helps people be a part. We say it's the difference between all are welcome here, and this space was created with you, specifically you, in mind.
I think what was different is that the topic of mental health was approached from the lens of community, and all of the people in the room who were invited to give the city and city partners feedback on what that means to them and what are the resources that they need and how we can support them in accessing mental health resources.
Our Latino communities, they have different barriers like language, information, stigmas about mental health, and we want our Latino communities to get those resources in Spanish. That's why we came here to know more about it and also to share this information to our Latino community.
It's every community. We need more resources, talk more about these problems that happens around the communities. It's really important.
It shouldn't be a one and done. The way things happen in community, especially communities of color, things travel by word of mouth until someone really experiences it, and then they're telling their neighbor and they're telling their family member and they're bringing their friends along, and that's how you get people to really understand and know that they are truly invited to the table.
They also talked a lot about having to drive either to Brooklyn Park or Minneapolis just to get resources. And so that's another reason why this work has to continue. We don't want our community having to leave Bloomington to access these resources. Our strategic plan and our motto and our goal and our vision is to be that remarkable community and a place where people want to be. And those community members that we heard from tonight, they want to receive resources, but they want to do that in Bloomington because Bloomington is a place where they are.
This has to be replicated. We have to continue the conversation.
I'm going to tell this person how I want this person to see me in the world.
Bloomington, Edina, and Richfield is popping up to get everyone to the table so that we can have conversations about mental health and how much it matters to not just me and not just you, but to our entire community.
That's a good